Well, thank you all for coming. My name is Dale Milner. I'm a licensed clinical social worker in private practice. I am also a trained sex therapist and a certified Kundalini yoga instructor. My other credential, you might say, is that I've been in a 33-year-old marriage with a wonderful fellow, and I am a cancer survivor. I had cancer, cervical cancer was diagnosed when I was 23. So I am going to tell you about relationships, intimacy, sex, and sexuality this evening. And it's a difficult topic to cover, so I'm going to instruct you in a breathing exercise to help everybody relax. And I hope that the breathing exercise will be beneficial to you at other points in your life, that you'll be able to use it whenever you're experiencing stress and tension. So I'm going to demonstrate. It's called the relaxation response, and I'd like all of you to sit up as straight as possible and straighten the airway. So your chin may even tuck in a little bit so that your entire airway is nice and straight. Uncross your legs, and you may have your hands on your thighs, or if you think it would be helpful, you can put one hand on your lower abdomen and your other hand on your upper chest to help cue you. Now, you're going to take the breath in through your nose, and imagine that the air has weight to it, as if it were water. So it's going to go in through the nose, hit the bottom of the lungs, and then you will fill from the bottom up to the top. And then you will exhale from the top down. And then you'll suspend the breath slightly on both the inhale and the exhale. So close your eyes so that you can go inward and just pay attention to your body. Look and see if you have any points of tension. Maybe your shoulders are tense, or your legs or your hands. But as you breathe in through your nose, take the air into the bottom of the lungs and exhale completely. So that's the best way to start, by exhaling. And then slowly begin to inhale. The belly pops out and the lungs fill all the way to the top. Suspend the breath and then exhale. I'm going to count the breath for you so you can have a nice slow pace. Now inhale, 2, 3, 4, 5, 6, 7, 8. Suspend and exhale, 2, 3, 4, 5, 6, 7, 8. Suspend, inhale, 2, 3, 4, 5, 6, 7, 8. Suspend, exhale, 2, 3, 4, 5, 6, 7, 8. Now I would like you to continue breathing long and deep, and just to relax and keep scanning your body for points of tension while I read the lyrics from a Martina McBride song that I think is especially poignant. It's called "I'm Gonna Love You Through It." Just keep breathing and relaxing and listen. She dropped the phone and burst into tears. The doctor just confirmed her fears. Her husband held it in and held her tight. Cancer don't discriminate or care if you're just 38. With 3 kids who need you in their lives, he said, I know that you're afraid, and I am too. But you'll never be alone, I promise you. She made it through the surgery fine. They said they caught it just in time. But they had to take more than they had planned. Now it's forced smiles and baggy shirts to hide what the cancer took from her. But she just wants to feel like a woman again. She said, I don't think I can do this anymore. He took her in his arms and said, "That's what my love is for. When you're weak, I'll be strong. When you let go, I'll hold on. When you need to cry, I swear that I'll be there to dry your eyes. When you feel lost and scared to death, like you can't take one more step, just take my hand. Together we can do it. I'm gonna love you through it. And when this road gets too long, I'll be the rock you can lean on. Just take my hand, together we can do it. I'm gonna love you through it. I'm gonna love you through it." So inhale now, and relax and open your eyes, or keep them closed if you prefer. So hopefully you all are feeling a little more relaxed now, and we can talk more about relationships and sex and intimacy. So in order to really best understand how to deal with problems, we have to be able to understand the nature of relationships. Probably most of you don't ever consider the fact that you have a relationship with yourself. Every relationship, including the relationship with yourself, has 4 aspects: the physical, the cognitive, the emotional, and the spiritual. The physical is how we treat ourselves and use our bodies. The cognitive, or what we think, is what we tell ourselves about ourselves. The emotional, of course, is how we feel about our bodies and about ourselves. And then the spiritual is a meaningful connection between ourselves and a higher power. Now let's shift our focus to personal relationships. Your relationship with your spouse, partner, significant other, same sex or opposite sex. It's all about the same in terms of the physical, the cognitive, emotional, and spiritual. So the physical aspect of our relationship with our partner is, of course, affection, sex, and general interaction. So this would also include chores and fun activities, raising kids together, just all of the things that you do each and every day. The cognitive is what we believe and think about our relationships. And I guess I like visuals to help me sort of process things. And I like to think about the fact that most of us have what I call our Times Square ticker tape or news feed that goes around and around in circles. So that, if you've ever seen the thing in Times Square, it's the same news that just keeps going around and around. And very often that's the way we work as well. We keep thinking the same thoughts, telling ourselves the same things until we learn something else or make an effort to break out of that pattern. So how we feel about our relationships and what we think about our relationships, they kind of also go in a circular fashion. So what we think affects how we feel reinforces how we think, and all of that, of course, affects our physical relationships. And if our relationship with our partners go well and smoothly, then we oftentimes feel like we have a higher or more spiritual connection with our partner. I read that song to you because, at least in my mind, I think it represents the ideal. I think we would all love to have a partner or a relationship that was going to be that intense and supportive. But in reality, even if you have that kind of relationship, generally speaking, you may not have it 24/7. As you go through life and as you go through difficult situations, sometimes it's intense and close and you get exactly what you need, and sometimes it's the opposite. So You know, there's an ebb and a flow to everything, and realizing this and realizing that it's a normal part of every relationship can sometimes help you get through the rough spots. Now, of course, we have relationships with family. I put in your handout, and I believe you all got a copy of this, so you don't have to worry about taking notes. Just sit back and relax, because most of the information that I'm going to share with you this evening, you'll be able to take home with you and share with others. So anyway, back to our relationships with family. The emotional connection that we have with family is extremely profound. It satisfies and meets our need to feel connected to a group. It's a survival need. Now, what we think about our families oftentimes came to us vis-a-vis our families. You know, when we're little, we're kind of blank slates, and they tell us what to think about being a part of a family. And then over time, that's what we adopt as the truth. And so that's what goes on our ticker tape. The physical aspect is our family relationships, is our survival is based on being physically taken care of. So when we're very small, we're born, I always joke and say we're born half-baked, because we have so much developing to do once we come into this world. We need caretakers to hold our heads up and to feed us and just to take care of our every need. And I'm going to refer to that in a little bit. And then, of course, you may or may not have a spiritual connection with your family. So if your relationships with family are good and strong and supportive, then you just may have that kind of extra profound, meaningful connection. But there are a lot of people who have troubled relationships with families. Yes.
Dale, I have a question from our national audience, and they wanted to know if your handout was actually available online as we had spoke.
I am going to make the handout available on my website, which is dalemilner.com. So there'll be a link, and you'll just be able to click on and be able to get the handout. Great. Okay, so let's now go back to talking about relationships with friends. The cognitive is what we tell ourselves about our friendships. The emotional, again, is how we feel about our relationships with friends. It could be positive, it could be negative, or anything in between. And then, of course, physically, how we interact with friends. And I added acquaintances as well, because there may be many people in your life that you're not necessarily emotionally connected to, but they may be coworkers or neighbors or bowling partners. One more point I'd like to make about relationships in general is that when you're going through cancer treatment or any stressful or difficult situation in life, some people who are friends may fall off the radar. Other people who are acquaintances may rally to your side and become very close and profound friends. I see some of you nodding. And even if you are a friend of someone who is dealing with cancer, recognize the fact that at various points, they may not have the energy for your friendship. You know, just because you want to be there and want to help doesn't mean that the person has the energy to receive it or is in a place right now. Sometimes you want to circle the wagons and you may just want to be with your nuclear family or you know, just a few selected friends. But it's helpful to recognize this and understand it. Gracious me, I thought I had this in order. I was going through my notes prior to this talk, and I was juggling things around, and I think I put things out of order. Yes, I did. There we go. An exercise that you might want to do sometime when you feel up to it is make a list of about 10 of the closest people in your life. Just write their names down real fast, first ones off the top of your head. And then I'd like you to think about each of these relationships with regard to those 4 aspects: the physical, the cognitive, the emotional, and the spiritual. And ask yourself, do some relationships meet some of those needs better than others? Are you satisfied with some or all of your relationships? Which ones and on which levels? What do you expect to get from your various relationships? Are my expectations realistic? Are my expectations usually met, or am I frequently frustrated or disappointed? Do I ever feel overwhelmed or out of control in my relationships? How would you like to feel in your various relationships? Do you get closer to your ideal in some, more so than others, and maybe at various times? What do you do to promote positive or negative feelings in your relationships? When I was downstairs, I was reading the statement on the wall down in the Navigation Center, and there's a line that says, "Knowledge is power." So I encourage you, make yourself knowledgeable about your relationships and all the other aspects that we're going to talk about as well. That gives you power. And another question you might ask yourself is, what would you need to change in your various relationships, and on which levels, in order for you to feel peaceful and satisfied? Now, I didn't say happy. The way I define happy to me is a response to an external event. It's like, oh, I won the lottery, yay, I'm happy. It's a high energy emotion. I got that job, or my test results came back negative. Yay, I'm so happy. It's hard to maintain that kind of high energy emotion. But peacefulness and satisfaction is something that is much more sustainable and is a much more realistic goal. So, as a couples counselor, over the years, I've come to recognize the fact that a lot of us, well, probably all of us, operate from a relationship myth. And that myth is that we want to be loved unconditionally. That's kind of the ideal, right? Well, unconditional love is more or less reserved for parent-child relationships. There's a power imbalance. Parents have all the power. Kids don't have the power. We love them through the biting stage, the kicking stage, the spitting stage, the wrecking the car stage, the talking back stage. We love them anyway. But in adult relationships, we're trying to achieve equal power. We don't have a power imbalance. So in that instance, we need to follow rules. Rules keep us safe. And so in that sense, there are conditions. And once both people buy into the rules or the conditions, then you can open your heart and love unconditionally. Achieve that intense feeling. But you gotta follow the rules. And I'm gonna talk about rules in one more second, but I want to also first describe the fact that in my experience, it seems to me that couples have one fight, just one fight. And that fight is, if you loved me, you would, ... fill in the blank. If you loved me, you would give me a back rub. If you loved me, you would buy me a new car. If you loved me, you would take out the trash. You get the idea? And then the counterpoint to that, or the response, is you're trying to control me. So the "if you loved me" comes from our inner child, because when we were little, we did feel that way. If you loved me, you'd give me a bottle. If you loved me, you would change my diaper. If you loved me, you would play with me, right? And then the teenager appears. You're trying to control me. And so both the little kid and the teenager are alive and living within each of us. And they oftentimes come out when we're fighting or when we're upset in our relationships with our significant other or other people as well. So let's shift now and look at some suggested relationship rules. Now, every couple gets to formulate their own rules. There's no right or wrong set of rules. I've just put down some that I think are kind of foundational. First, maintain honesty and trustworthiness. I mean, if you don't feel like your partner is honest with you, it's awfully hard to relax and to really get as much out of the relationship as you possibly can. No violence, physical or verbal. You know, the physical violence, most of us think that's a no-brainer. But words hurt. Words can damage. So we need to be aware of what we say and how we say it. Maintain personal integrity. This is really important. A lot of times when we get into relationships, we are all consumed with the love and the connection and the we-ness of being together. And sometimes we lose sight of the I, what I need, what I feel, what my values are, what my ethics are. And I encourage couples to develop strong personal integrity, because the healthier you are as an individual, the healthier your relationships will be and the stronger they will be. Tell the truth with kindness. So sometimes couples will come into my office and one or the other, both will say, well, I'm just blunt. I just say what's on my mind. Well, saying what's on your mind is a good thing, but again, you have to tell the truth with kindness. Because like they say, once the milk is spilt, you can't put it back in the bottle. Once something is said, it's out there. And you can't reel it back in. So it's almost like, if you had a glass and it takes a second to knock it off the table and break it into 1,000 pieces. It takes a long time to glue it back together. Say what you mean and mean what you say. So sometimes in the heat of an argument, people just, whatever pops into their head, they say it. And they're throwing anything and everything at their partners that they can because they're upset. And sometimes people issue ultimatums that they have absolutely no possibility of following through on. They don't intend to follow through on. They're just trying to get their partner to do what they want. So be careful about that, because that's not really a good idea. Fight fair. If someone tells you something and later during an argument it comes out, that's the classic hitting below the belt. So really be mindful of that and try and avoid that. Be willing to compromise. Get some and give some, so there's no winners and losers. If you have a winner and a loser, then ultimately both people will lose in the long run. It acts as a wedge in your relationship. And the loser is going to feel like a victim. It's going to feel powerless, so you have a power imbalance. And then they may end up feeling resentment, may end up acting out that resentment in passive-aggressive ways. So that's not something that promotes really good closeness between people. And then work toward achieving the 4 points of balance. Now, the 4 points of balance were developed by David Snarch. He's a psychologist who works with couples, and he is also a sex therapist. And I've referenced his books in your handout. They're wonderful resources for you. And the 4 points of balance are: develop a strong, flexible self. So this is a lot along the lines of what I was talking about when we talked about personal integrity. You know yourself, you know what you need, you know what you feel, but you're willing to be flexible. So if you dig in your heels, you're going to have a Mexican standoff. You're not going to get anywhere. So be willing to be flexible. And then when you feel good and strong within yourself, you are then able to develop the ability to calm your own heart and quiet your mind. So very often when something's happened in our relationship, the emotions are just really carrying us away, and we're just so upset, and we may just say things that we don't really mean, or we're just lashing out. And if you can take responsibility for your own emotions, to calm your own mind and heart, then you can make a grounded response. And a grounded response is a response that you feel will help to resolve whatever the crisis is, or the disagreement. So you're not just flailing about, or just, like I say, saying what's on the top of your mind, but you're being thoughtful about what you're doing and what you're saying. And then that leads to learning how to achieve and maintain meaningful endurance. So if you're in a long-term relationship, there are going to be many, many ups and downs, many trials and tribulations. And you have to recognize the fact that there are going to be times where you're going to be hurt. There are times where you're going to be anxious. There are times when you're going to feel depressed or sad, or, hopefully there'll be more joy than sadness and anxiety. But of course it is a normal part of a long life with another person. So now we're going to shift our focus to talking about communication. When people talk about real estate, they always say, location, location, location. Well, us couples therapists say communication, communication, communication. Because it's the vehicle for enjoyment, intimacy, and problem solving. Now, I want to teach you a technique for good communication. What we know from all of us who work with individuals, that sometimes it's a lot easier to say what's on our mind than it is to hear what our partners have to tell us. So if we have rules, again, structure makes us safe. If we follow some of these rules, we can actually accomplish and solve problems, accomplish something meaningful. So I'm going to go through the steps, and if you all have any questions about the reflective listening technique, it's also called mirroring technique. You may have heard it called different names. So somebody has something on their mind. So they're the speaker. They approach the partner. Partner is the listener. The speaker then states to the partner that they would like to discuss whatever it is. But you want to state the topic in 25 words or less. So it's not what kind of typically happens. I'd like to talk about, and then you launch right into whatever it is you want to say, and the other person might be going, wait a minute. So it's important that the speaker says, I would like to talk about, let's use something easy. I would like to talk about finances. Easy, right? The listener then says, I understand you'd like to talk about finances, and it may be a good time. And so the listener would want to indicate that. But if it isn't a good time, they need to tell the speaker that information. And just, can't we talk about this later, feels like a brush off. So you want to give a specific alternative, such as, can we talk at dinner this evening? Can we talk Saturday morning? Something along those lines. Because if someone is not in the right frame of mind to engage in a conversation, then you're not going to have a productive exchange. Their head's going to be off somewhere else, what have you. And so, assuming that it is a good time, then the listener goes into what I call a protective bubble, where they feel they won't be hurt or attacked, but they can turn their mind over to the speaker to truly understand what the person is trying to convey. We know from research that most people only hear about 40% of what's said. The way we typically work is you'll hear something and then your mind goes off in another direction. So you might be thinking about your rebuttal, or you might be thinking about something that happened at work or what have you, and you're not really tuned into everything that's said. So if the person feels that they don't have to worry about being attacked, they're much more apt to be able to listen intently. And I always say that listening is one of the greatest acts of love. It's a very profound, loving gesture to turn off your thoughts and really turn your mind over to your partner to really understand. So now the speaker is going to give the listener a paragraph or two of information, not go through the whole laundry list, but it might be something along the lines, using the financial example. I'm worried about finances. We have all these medical bills, and Johnny or Susie needs braces, and the roof is leaking, and I'm just really worried about how we're going to manage our finances. And then the listener will reflect back what they heard. So it would be something along the lines, I really understand that you're worried about finances. Is there more? Now, this is probably not a really great example because it's so short, but if the speaker has presented what they wanted to say in the first paragraph or two, and the listener reflects back what they heard, the speaker then says, you got it right, or you got that part correct, but you missed this part, or you didn't get that part, and then they'll restate. And then this process goes back and forth until such time as the speaker says, well, that's really all I want to say about that at this point in time. And then this listener will do a general summarization. So this isn't a dialogue. This is going one way so that the person is heard completely. And the listener then will do a general summarization and then offer some statement of empathy or validation, and validation, ideally. So it might be something along the lines of, I understand that you're really worried about finances. We have a lot of obligations. I too have my concerns, but I feel that if we put our heads together and really think about it and work together, we'll be able to solve our problems. And I really appreciate your telling me your feelings. So that's kind of the nature of the reflective listening technique. And before we move on, one last point. At that point in the exercise, the listener can now become the speaker, and the speaker becomes the listener. But if the original listener is not prepared to talk about the subject at that point in time, they don't have to. It's not an obligation. You might say something along the lines of, well, I'd like to think more about what you said here today, and I'd like to talk about it at a later time. Or they could even change the topic. So these are all options. Okay? I hope that makes sense. Now, we're going to shift from talking about relationships in general and communication to talking about intimacy, cancer, sex, and sexuality. In terms of definitions, intimacy is the broadest form of connection between two people. It includes, like I said, the four aspects: the physical, the cognitive, the emotional, and the spiritual. It is things we do together, and it's beliefs and thoughts and feelings that we share. That all falls under the umbrella of intimacy. Sex is what we do. It's an activity. Whereas sexuality is how we feel about ourselves, about our gender. It's linked to our need for caring and closeness and touch. So this is just, to kind of clarify in your own mind, sex and sexuality and intimacy are all integrated, but you can think about them in terms of there being, kind of different aspects. Now, one statistic, and I'm not a great lover of statistics, but this one really knocks my socks off. And I've read this from many different sources. 50% of all adults at some point in their life experience sexual dysfunction, sexual problems, or dissatisfaction. 50%, that's a lot. And so this is, before cancer and treatment and, complications. These are just everybody. Now, sexual dysfunctions, to give you some examples: erectile dysfunction in men, let's see, premature ejaculation, retarded ejaculation. In women, it might be dyspareunia, funny word, which means painful intercourse. Anorgasmia, the inability to orgasm. Vaginismus, which is a spasming of the muscle at the entrance to the vagina that prevents intercourse or makes it extremely painful. So these are examples. There are others, but these are kind of the more common or familiar sexual dysfunctions that we see. Sexual problems would be like two people fighting over frequency of sexual contact or sexual activities. One person might want to do one sexual activity and the other person is resistant and they disagree and fight about it. So that would be an example of sexual problems. And then I think dissatisfaction is self-explanatory. Oh dear, part of my, here we go. I just have to shuffle papers, sorry. In order to really understand, I said knowledge is power, so to really understand our sexual relationships, we need to understand the human sexual response cycle. There are 5 stages. Desire, which is anticipation, fantasy, yearning, physical and emotional openness to sex. The next phase is excitement, which is the subjective sense of pleasure plus physical arousal. In males, there are erections. In females, and females are a lot more complicated, females, there's increased blood flow to the pelvic region, vaginal lubrication, swelling of the genitalia and breasts. The outer third of the vagina narrows, and the upper 2/3 of the vagina widen and lengthen. The next phase is the plateau phase. The plateau phase, there is arousal, but the arousal isn't building. It levels off and is maintained. And there is pleasure without orgasm. The next phase is orgasm. So sexual pleasure peaks, and there is rhythmic pelvic muscle contractions and release of sexual tension. And the final phase is satisfaction and resolution. That's when the body returns to a non-aroused state. Both males and females experience a pleasant afterglow, feel relaxed and sexually satisfied. The length of time in the afterglow state is related to the length of time in the arousal and the plateau stages. When I talk about hormones in a minute, this will make a little more sense. So even without orgasm, resolution can take place. It may take a little bit longer, but nevertheless, it will take place. And yet there is still satisfaction, because satisfaction is a subjective feeling. They say this is the biggest sex organ that we have. Now I want to talk about hormones. Most of us know about the 4 basic hormones: the estrogen, progesterone, testosterone, and androgen. I'm not going to go into it a great deal, but these 4 hormones are coursing our bodies all the time. And both men and women have all 4 hormones. And it's just in differing proportions. So estrogen is considered the hormone of nesting. It encourages women to find a mate, build a nest, and put babies in it. The progesterone is the hormone of pregnancy. It prepares a woman's body for the fetus. The testosterone is the hormone of lust, which is the main male hormone. And then androgen, and this is my personal description, it's the hormone of beards, big muscles, and deep voices. I mean, these hormones do lots of different things in our bodies, but just for our purposes, that's why I describe it. Now, there are two other hormones that we need to know about, and these are really important. They're not in our systems all the time. They are produced when we have physical contact with another person. They start to be produced in the body, the oxytocin and vasopressin. So you may even gaze into your partner's eyes with anticipation, and the oxytocin starts to be produced. Now, if the word sounds at all familiar to you, you may have heard the word Pitocin. Pitocin is the synthetic of oxytocin that doctors give women to induce labor. So it produces the uterine contractions and you know, the milk coming down and all of the rest of it. So that's the Pitocin. The oxytocin is what's formed naturally in the body. And that is called the hormone of love. So when we were talking about the afterglow feeling, and we've been producing all this oxytocin, that's what we're experiencing during that afterglow time. And then the vasopressin. Mother Nature, brilliant. Well, if testosterone is the hormone of lust, that means that, you know, back when we were evolving and lived in caves, men typically went off hunting, and the women stayed home and picked berries and whatnot and raised the children. And so the men were off, like I said, and they were apt to bump into a cute gal from another cave and might be inclined to go behind a bush and, you know, play around. So from a genetic standpoint, this is a good thing because we know that genetic diversity makes for a stronger species. But Mother Nature wanted that fella to come home to help the woman raise those babies. So the vasopressin is what is the hormone of loyalty. So that indicates that the best sex, the best love, the best experience for us is going to be back at the home cave. And it's interesting because there are some studies that have been done in some, you know, I think they're little voles or something. There's not a whole lot of species that mate for life, but those little voles happen to be one. And they have higher levels of vasopressin in their system. So that's how we know it's the hormone of loyalty. I just want to throw in another little fact that I think is interesting. There was a study that was done at Wilkes University in Pennsylvania that showed that people who have sexual contact once or twice a week produce 30% more immunoglobulin A. I have a hard time with that word, but that is a substance in the body that helps our immune system. So you know, sexual contact is not only good for us emotionally, but it's also good for our physical well-being. Cancer treatment can cause changes in any phase of the sexual response cycle. Question?
Yes, so we have one question, and then also we have a couple, right after this next section, we're going to have a couple questions about this topic you're about to get into also.
All right.
But, one question is that can you have excessive amounts of these hormones that you were just talking about, oxytocin or vasopressin? Can you have excessive amounts?
No, your body knows what it's doing. It produces, you know, so it's not the kind of thing that you can overdose on it. It's just part of the natural experience. So no. Another question?
Well, once you get through this next section, there's going to be a couple more questions.
Okay. Now, one of the reasons, like I said, that I think it's important for us to understand the human sexual response cycle is to be able to communicate with our partners as well as our physicians. So if we're going through cancer treatments, we may say, well, you know, I'm having problems with desire, or I'm having problems having orgasms, or I'm not getting very aroused. So if you understand these different phases, you're going to be in a better position, like I say, to communicate with your partner, and then also to talk to your physician to get specific remedies for whatever particular problems you're experiencing. So just going into your doctor and saying, well, I'm having trouble with my sex life, isn't specific enough. So it's going to be much harder to have them address your specific needs. Now, a few things to keep in mind about sex before, during, and after treatment. Sex is safe during treatment unless your doctor says no. So, you know, that's something that you need to check out, but there's basically no reason that you have to refrain from sexual contact during treatment. Birth control should be considered and discussed with your partner and your doctor. Even though you may be on chemo and you're of childbearing years, you can still get pregnant, and the chemo you're receiving may in fact affect the fetus, so you need to check that out. Some chemos stay in your bloodstream a while, so condoms or dental dams are a good idea, especially a few days after treatment. Now, often people say, what are dental dams? Dental dams are made out of a similar kind of material that condoms are made out of, and they're used to protect the mouth so that you know, there may be some chemo that shows up in your bodily fluids, either vaginally or, you know, in your mouth. So it doesn't mean you have to refrain from kissing, but using some protection. Another question?
Yes, we have 3 questions, and so
Okay.
I'll answer one, ask you to get you to the answer, and then I'll ask the subsequent
Okay.
ones. So the first one is, this person is a breast cancer survivor, and she has a visible scar from her surgeries, and her partner, when he sees the scar, is not physically attracted to her, and was wondering if you have any comments or thoughts on how she might. How
Well,
they
I'm
might work on that.
I'm gonna get to that, and I'll talk more about it in a minute. So if it's okay to kind of hold that question, I will cover that.
Sure. I've
Another
got 2
question?
more.
Okay.
Another person was curious about if certain types of chemotherapy cause specific types of sexual dysfunction that you're aware of, and if you know which chemotherapies and which dysfunctions.
Wow. You know, I really didn't want to get into the nitty-gritty medical side of things. I really want to encourage you to talk to your physicians about that. And I hate to say, well, this medication produces that, because, you know, there's always exceptions. And if you have kind of an idea planted in your mind, well, this should be the reaction or the side effect, then sometimes it's a self-fulfilling prophecy. So best to talk to your doctors about that and to see what you are experiencing rather than kind of anticipate side effects.
Great. And I have one more. Another listener was curious if you have any advice on a lack of sexual desire based on a chemo-induced menopause.
Well, if we could hold that answer as well, because I am going to talk about that some more. So if I don't cover it thoroughly enough, please write in again and ask for more specifics, but I do plan to cover that. Okay? Along the same lines as far as things to keep in mind about sex before, during, and after chemo, radiation therapy does not affect your partner unless radiation treatment is introduced into the body. And those effects could last days or weeks. So for some men who have had prostate cancers, sometimes they introduce radioactive seeds into the body, and that's one treatment. So if that's the case, again, talk to your doctor about that and ask when it is safe for you to be close to your partner. And then, of course, fertility issues need to be understood and decided upon prior to the start of cancer treatments. I could probably do, a whole complete talk about fertility, but, we're kind of pressed for time, so I'm not going to cover it fully here, but just recognize the fact that fertility is important to think about. There are wonderful ways of protecting your fertility, harvesting eggs and sperm, and certainly surrogacy, adoption. I mean, there's just a long list of things that help people to have a family at some later point after treatment. Now, some typical physical problems for female cancer patients that affect intimacy: loss of desire and no mental arousal. So I think that was part of the question. With or without menopause, it's a frequent complaint. It's a frequent sexual problem that many people experience. And that goes back to what I was talking about before. What we think about, what we tell ourselves, how we feel. So if we have certain experiences, a lot of times people who have had sexual traumas in their life, they're going to have a problem sometimes later in life with regard to sexual functioning. Another statistic, and it may be old, but with all this Penn State stuff happening in the news now, 1 in 4 females have been sexually abused or molested, and 1 in 9 males. A lot of people. So there are a lot of people out there who have had things, they've been sexualized in a way that is not just positive and, where they feel powerful, and they've been used, and so this does affect your sexuality later in life. So I said loss of desire, mental arousal, and then of course all of you know fatigue is a problem. It's a frequent problem, just too tired. Sex play is a physical activity, and sometimes you just aren't up for it, just don't have the energy for it. Vaginal dryness is also a very common problem, particularly if you're younger and you've been surgically thrown into menopause. This is not something that's happening gradually, so you're not even getting used to it. It's just kind of hitting a brick wall. And I'll talk about things to do about that in a minute. Pain of any sort, especially with vaginal penetration, is going to be a problem. It's just a human reflex to avoid pain. So anytime you're feeling that you might experience pain, you're going to hold back, you're going to draw back, you're going to be self-protective. The longer time might be needed to achieve orgasm, or you may experience the inability to orgasm. Hormonal changes. Again, if you have been in your fertile years and your hormones change drastically, it's going to change your feelings. It's going to change the way your body works and responds. And then, of course, nausea, vomiting, diarrhea, constipation, gas, weight changes, scars, sensitivities to taste, smells, and sometimes touch. All of those things are going to play a part in affecting your intimacy. Now, some typical physical problems for male cancer patients that affect intimacy: erectile dysfunction. ED, I mean, there are commercials on TV constantly about ED, so I put that number 1 since that seems to be a big. Yeah, we have a question?
Yes, so it goes back to something you were talking about a couple minutes ago, and this listener is curious about, they're a little confused about the connection between sexual traumas and how you related that to cancer, sex and cancer, or...
Well, I guess I wasn't exactly relating it, but it connects just in the sense that if you have those experiences or have had those experiences and have been sexualized early on in a way that maybe makes you feel out of control or embarrassed, or it causes problems for you, and those predate cancer, but then when you have cancer on top of it, it makes everything more challenging and difficult to deal with. So that would be the connection. So, it's difficult for everybody who's been through that, but it's going to then add another layer of complication for you to work through. So we were talking about erectile dysfunction. Probably it's the most common thing that I hear from men, even without cancer. That's why Viagra and Cialis and Levitra came to be, because it is such a common problem, particularly as men age. And men experience erectile dysfunction at whatever age, potentially periodically in their lives. If a man has had prostate surgery, prostate cancer, testicular cancer, bladder cancers, the cancers of the lower part of the colon or rectum, the surgeries and chemo and radiation that might be needed to treat those cancers may compromise a man's ability to get erections. And I'm going to say more about treatments and things in a minute. Certainly fatigue, same as with women, loss of desire, no mental arousal. Delayed ejaculation may be something that occurs because of cancer treatments. Inability to achieve orgasms. Pain in the pelvic region, hormonal changes, and then of course similarly nausea, vomiting, etc. It's all going to play a part in your willingness to be intimate. So talking again about erectile dysfunction, I guess it's important for men to understand that typically we think that men are supposed to have desire, get aroused, maintain an erection throughout the play period, have an orgasm, and then, satisfaction. And those are the cycles. And that's what we think is normal, right? Well, in fact, men don't do that. And most people don't really realize this. The way it works normally, and this information came out of the work that Masters and Johnson did, if you've heard about them. They did all of the original research on human sexuality back in the 60s and 70s. And I remember reading an article by William Masters about this. He said the best way to think about it is that when a man is in his prime, the 17 to 25 range, he's capable of having an erection. We'll call that 100%. I mean, that is the best. So during any sexual play, a man is going to lose about 25% of the blood that's trapped in the penis that is causing the erection. That's how it works, right? The blood gets trapped in the penis and makes it hard. So because a penis is living tissue, it needs oxygen. So even during the play period, that may, last a while, about 25% of the blood has to drain out of the penis so that there is room for new oxygenated blood to take its place. So this is all well and good in a young man, because if you have 100, you're starting with 100%, you lose 25%, 75% kind of doesn't look any different. It's very usable, nobody pays attention. But once you're a little older, you're no longer able to have 100% erections. So say, let's go with the math, this is not accurate, but say a man in his 50s and 60s might only be capable of having a 75% erection. It's a good usable erection, but now he also is going to lose 25% in order to have reoxygenated blood take its place. Now 50%, so it's sort of usable, sort of not. But what tends to happen, what William Master said, is that at that point a lot of men start watching to see if they're going to lose it, to see, if they're going to be able to maintain it, and then they lose the rest of the erection. And so at that point, a lot of times people get discouraged and they just say, oh, forget it, and leave the bedroom. Well, it's much better if you understand this, because if you just continue playing and you just continue enjoying yourself and relaxing, it'll come back. But if you're thinking that something is wrong and you're thinking that you have a problem, then you're going to have a problem, So a lot of times then, if a man loses his erection, his female partner might feel, oh, he doesn't care about me. He's not attracted to me anymore. He really wants a younger person, or he wants someone else. Well, now you're creating all sorts of relationship problems, when in fact this is just a normal part of male physiology. So that's important to recognize. Now back to erectile dysfunction and surgeries and treatment. So what tends to be the cause of problems is that when your physician goes in to remove the cancers, he or she may possibly cut or bruise the nerves or the blood supply to the penis. And so this is what may then compromise the ability to have erections or orgasms. Some men, even though men who've had vasectomies, will have what we call dry orgasms, where they don't produce semen, but they still have the pleasurable feeling and the spasming. And some men claim that even if they get erections after cancer treatment, that it feels different. It may feel weaker. This is a possibility. But with proper stimulation, practice, and patience, many men can achieve orgasm even without erections. Question?
Yes, we have a question from one of our audience members. Are the majority of sexual dysfunctions a biological or physical issues before or after radiation and or after treatments of cancer? So, sorry, I'll repeat that.
Yeah.
Are a majority of sexual dysfunctions biological or physical issues before or after radiation and or other treatments of cancer? So,
well, if 50% of adults are experiencing some form of sexual dysfunction, even without cancer, these things may exist, but then after treatment, and if, like I said, the blood supply or the nerves have been compromised because of the treatments, there may be additional problems that result. So sometimes the sexual dysfunction may be because of treatment. Sometimes it doesn't have anything to do with it. It just may be something that's there, or something that evolves because of age. Or men who are overweight, smokers, have diabetes, other problems along those lines, are more apt to have difficulties with erectile dysfunction. Let's see. Younger men do tend to have a greater ability to regain their ability to have erections after cancer treatment, because they don't have the aging factors to add into the equation. And as I said before, if men live long enough, they're going to experience some difficulty with erections. They're just not going to be as reliable as they were at a younger age. Let's see. If a man has the desire and determination to find new approaches plus practice, they can increase their ability to have erections and orgasms. So sometimes it's very challenging. Sometimes it's impossible, again, because of the nature of their cancers and treatment, but that doesn't mean that they can't experience enjoyment and pleasure and satisfaction. You just have to find other ways of achieving that. Hormone therapy in men, sometimes it's a form of treatment for prostate cancer that is similar to actually having the testicles removed. It's a kind of, want to dampen the level of testosterone because some cancers feed off the testosterone. So the doctors try and suppress the testosterone level. So that may interfere some with desire. You know, you don't have as much hormone of lust in your system. But again, don't forget, we still have this big sex organ. And so, you know, whatever is happening physically, sometimes we can counterbalance that with how we think about things and what our expectations are and the like. All right, just quickly some contraindications for intercourse: heavy bleeding, nausea, fatigue, mucositis, which is ulcers in the mouth of the vagina, radiation ulcers, and surgically produced changes that cause scar tissue that may lead to pain for men or women. So I talked about pain before and how pain is, you know, a bucket of cold water on your sexual desire. And we just have these natural inclinations to resist pain. So if you're mindful of that possibility and you go slowly and you're patient, you may find that there are ways of being intimate that don't produce pain. And if you're working well with your partner, you can kind of take things slowly and not get to the point where there's actual pain. Now I want to shift focus and talk about the emotional effects of cancer. Now, all of you who have been through this already know what I'm going to say, that anxiety, depression, low self-esteem, especially when there are bodily changes, are very common and very prevalent. And they may come, they may go, but I do want to stress the fact that depression and anxiety need to be treated and not ignored. If it occurs for a short period of time, okay, that's understandable. I mean, we all feel that, just even without cancer in our everyday lives. We feel sad, we feel anxious, we feel this, we feel all sorts of feelings. But feelings change and they come and they go. But if you find yourself sort of feeling anxious or depressed for long, long periods of time, I really want to encourage you to get it treated. So there are medications, you know, SSRI, antidepressant medications, counseling, support groups. I want to encourage you to take advantage of all of these different modalities. One side note about antidepressants, you all may have heard about the fact that sometimes they interfere with our ability to feel desire and to get erections and that sort of thing. Sometimes men say that antidepressants affect their ability to orgasm. So you just have to balance what's going on. Sometimes being on antidepressant medication for a period of time will kind of break up the depression or the anxiety, and then you can get off of them. But if you find yourself just you know, can't get out of bed, and we're not talking about fatigue, we're talking about emotional fatigue, which is more along the lines of depression. That's something that you should really address and treat. So often during cancer treatments, patients' need for intimacy and affection increase. It's unfortunate that this occurs when our relationships may be strained by worry and concern. Our emotions play a huge part in our sexuality. The way we feel about ourselves and our bodies can affect how we interact with others. You may feel inadequate, out of step with your partner, not sure what to do to feel better. Both you and your partner may experience the same or similar feelings at the same time or at different times. So just be aware, okay? Now, some emotional effects on sexuality and relationships. A question?
We have a couple questions. It
Oh,
sounds
okay.
like this is around the topic that you're in now. So
Okay.
I'm going to combine a couple because there sounds like similar comments. We have one that says it's along the lines of feeling guilty, and the statement was along the lines of, "Why would someone date me when they could be with someone healthy?" And I was wondering if you have any kind of comments or thoughts on that emotional aspect of cancer.
Well, I guess in some respects I would refer you back to the very beginning of the talk, and that there are these different aspects of a relationship. We're not just bodies. You know, we have minds, we have personalities, we have interests. There's just so much more to being a human being than just being a body. And so, you know, if you're with somebody and it's all about the body, you might ask yourself, is this person worthwhile? Do you really want to be with a person who's just with you because of the way you look? Because, I mean, even without going through any kind of surgeries that change your body, you're going to age. You know, you're going to get gray hair, you're going to get wrinkles, you know, but there's more to the connection between people than just your physical self. So I would hope that you would seek out people who want to be with you for a lot more than just the physical side of things.
To add to that, do you have any comments on someone who might have been partnered with someone, married to someone for many years, and they have the fear that that person might move on? You know.
Well, actually, that was kind of almost my next point. So changes in appearance may be stressful and cause you to feel unattractive and self-conscious. These changes can interfere with your ability to focus on sexual excitement and pleasure. Surgeries that change your appearance may be especially challenging. But again, it's challenging, not impossible. So knowledge is power, being aware, taking the time, understanding, working with your partner can do wonders for this problem. Negative emotions like anger, guilt, stress may also keep you or your partner uninterested in pursuing sexual contact. So even at a time where you need more support and you need more caring, you still may be afraid. So you just, you know, pull back because you're afraid of being rejected, afraid of being criticized. So these are emotional effects that need to be addressed. Let's see, feeling afraid may distract you or your partner and cause you not to care about sex. So it just may, you know, just doesn't exist, don't care, just push it away. It's too complicated, it's too hard, when in fact it can still bring so much joy and pleasure and connection and comfort. So I would encourage you to address that. Some people are afraid of giving or getting cancer from their partner. Sometimes, even if cognitively you know, I know that cancer, it can't be caught. It's not a flu. It's not a virus type thing. I can't catch it. Maybe somewhere deep inside there is still that little fear. And so acknowledging that and seeking out information, talking to your physician about it, researching it online, you know, talking to a counselor, and doing whatever you have to do to get that changed so you don't continue to believe that and act on that. Your partner may be fearful of causing harm or pain, therefore they keep you at a distance, which then leaves you worried and confused and feeling rejected. So they may have good intentions, they don't want to hurt you, that's a good thing, but in fact what you're experiencing is rejection. So be aware of this, acknowledge it, and work on that. Stress, of course, reduces sexual desire. Tension, anxiety, or trouble getting in the mood for sex can interfere with your ability to reach orgasm. So even if you do play and you are trying, still you're tense, you're tight, you're worried, you're anticipating something negative, it's going to be really hard to experience that release and orgasm. You may feel helpless and frustrated by changes beyond your control. You know, it's so hard for us to be out of control. The reality is that none of us is really in control. We're, you know, just spinning in space on a big dirt ball. You know, we're not really in control. But nevertheless, we kind of, I guess, like to feel in control, and we like to control, you know, the little aspects of life that we can. But when, you know, we're thrown into dealing with something as huge as cancer, it just feels like everything is out of control. And so, again, knowledge is power. You may feel helpless about your loss of fertility. So we talked about that a little bit earlier. I'm sorry?
What was the word you lost?
Fertility. You may feel fear of rejection, so you pull away before your partner can reject you. This goes on in relationships all the time. I know I'm going to be rejected, or so I won't even get into a relationship. Or I'm in a relationship, I date somebody for, you know, a while, and then I break it off because I know they're going to just, you know, see the real me, and they're not going to like me, and they're going to reject me, so I'm not even going to bother. So that's a problem, again, to be worked through. For anybody, you know, because this goes on in everybody's lives. So you may feel embarrassed that your partner may be your caretaker sometimes, thus you have trouble switching to being lovers. So if somebody has changed a dressing for you or held your head while you're sick, then, you know, switching to the role of lover may be difficult, you know, these different roles. And you may lose desire for your partner if you have unresolved conflict. So if you've had a troubled relationship prior to your diagnosis and treatment that hadn't been addressed, it's just going to get more complicated with the stresses that you're going through. So again, I encourage you to address that. And some of you may have had relationships, long-term relationships, that fell apart during treatment. You know, these are other life's challenges, and it can be very painful and difficult and just add to everything you're going through, but it does happen. Now, some more challenges is how do you share raw emotions without overburdening your partner and vice versa? Some people worry about that. You know, I've got to be strong, I can't fall apart. I don't want to overstress the other person. And this, again, can be addressed and worked through, because sometimes you do need to fall apart. You can't always be strong. You can't always put this strong outward appearance for the world. Maybe you do at work, but not at home. You know, there's got to be times where maybe your partner needs to fall apart sometimes, and you're going to be the strong one. So together, this is part of intimacy. How you adjust to the new normal. So maybe you've had, I think the person was asking about scarring and that sort of thing. Well, you know, I'm going to talk more about specific things that you can do, but I'll kind of go in that direction now. Certainly, if you're upset by the way you look, do consider reconstructive surgeries. Talk with your physicians about what can be done for scarring. I also encourage people, if you're feeling uncomfortable, put something sexy on. You know, they have these great teddies, these silky things, you know. You don't have to be totally naked to play and to receive stimulation and to get that oxytocin going. You know, if you feel more relaxed and more comfortable, and guys too, I mean, they have great silky boxers and, you know, all kinds of different things out there. Take advantage. Let's see, how do you give up or take responsibility? This kind of goes hand in hand with control. You know, if you've been a person who's just been responsible for everything, hard driver, that sort of thing, it may be very difficult to kick back and give up some responsibility. And, you know, the new normal, like I said. And, another really, really, really important thing is how to handle family, friends, and children. how to talk to children. A lot of times people say, oh, we don't want to overburden the children. We don't want to frighten them. We don't want to cause them to worry, so we won't tell them what's going on, that mommy or daddy is sick and has to go through treatment. But I would encourage you to get with your partner and talk about what is comfortable for you all. Now, of course, in talking to children, you're going to gear your conversation to their age, to the questions that they ask, but they're going to feel much more comfortable if they know something. If you know, I keep saying knowledge is power because it's so true. Let them know something and give them information that they can begin to work with and get their mind and their emotions around. And then as they ask questions, then you together as a couple will be able to address them and help them through it. So I was talking about some of the things that you can do to make your sexual contact better. You know, I was talking about possibly, we have a question?
We have a couple questions.
Okay.
The first one that I'm going to ask is related to that you were just talking about children, and one of our audience has a 13-year-old daughter who's currently going through puberty and has fear that she's going to get breast cancer, and if you have any suggestions on how to communicate in that relationship.
Oh, 13 is a tough age. Boy, because that's really when the hormones are kicking in, and I haven't met a 13-year-old who isn't depressed. I mean, it just seems to be a normal part of being a 13-year-old. The hormones are raging and everything else. I would suggest that you communicate openly with your teenager, that giving them information, just as when I talked about if you have worries about giving or catching cancer from someone else, having good, accurate information. Possibly you might take your child to your physician with you and have the doctor or one of your healthcare team talk to the person, to the 13-year-old. Sometimes, you know, when they hear it from somebody, they consider, you know, the expert that can allay their fears. So there are different ways of approaching this, but you know your child, and so you're going to be the person best able to determine the way to reach them. But like I say, information should be helpful, and so articles about, shall we say, statistics of the likelihood, and yes, there may be a greater increase of with the familial connection, but that not everyone who has a parent who has breast cancer gets breast cancer themselves. I mean, far and away more people don't get it, and so sometimes just knowing this can reassure the teen. Another question? Okay, that's it for now. All right. So we're talking about possible remedies for sexual problems. So I was encouraging you earlier to deal with, you know, depressions and anxieties and that sort of thing. So I also want to encourage you to deal with any sort of sexual difficulties that you're having. So consider, like I said, wearing things that make you feel sexy. Keep your sexual pilot light lit, which means be aware of your sexuality and aware of sexual stimuli around you. Instead of sort of shutting down, closing down, and, you know, you want to feel handsome, you want to feel pretty. You know, many of you have a beautiful cap on, and it has a bright scarf. It's wonderful. It just makes you feel feminine and attractive. It's lovely. And these are things that can really help us to stay in touch with our sexuality. Considering alternate sexual positions. So if you've been a couple who's just always done missionary position, that may not be comfortable anymore. It may not work anymore. So, you know, you might try it in a chair. You might use pillows. You might try all sorts of different ways of approaching your intimacy. Timing of intimacy is crucial. As you know, sometimes you have more energy than at other times. And if you all have been in the habit of late night sex, which in my opinion is the worst, anyway, even apart, you know, it's sort of like something, okay, I've been to work and I've cleaned the house and I've done the laundry and okay, now I gotta have sex. All right, whoop-de-doo, you know, not too exciting. But if it becomes something special and a priority, and you want to use your valuable energy on it, then you're going to time it. So if you have the highest degree of energy at 2 in the morning, or 2 in the afternoon, or whenever, that's the best time to consider being intimate, as opposed to by the clock, So be aware of how you feel and communicate that to your partner and do what you can to make it happen at those times. Adjust expectations of self and partner. And that has to happen with age anyway. Like I said, as you get older, ability to get erections and hormonal levels and all of that's going to change anyway. So if you're going with the flow and paying attention to your body and communicating to your partner and working together, you can overcome these problems. I mentioned the good communication and the sexual pilot light. Know your own body and know how it's changed. So sometimes through self-exploration, you can learn things about yourself that you can then communicate to your partner. So maybe before your treatment, you might have liked a sort of a stronger or a heavier touch, and now you might like a lighter touch. So you have to be able to communicate this to your partner. They can't just kind of discover it. It's going to be best if you give them this information. And then I say, make sure your sense of humor is intact and use it liberally. I tell you, the sex act is probably one of the more undignified things that we do. And you need a sense of humor about it because you make funny noises and you're groaning and grunting and moaning and slurping and all these different things. And, if you can laugh about it, if you don't take yourself too seriously, then it can be fun, But if you're uptight and it's trying to make it all dignified, it's not so much fun. So keep that in mind. Now, certainly for women who have problem with vaginal dryness, there are lubricants. There are water-based and silicone-based lubricants that can make intercourse more comfortable. There are also moisturizers like Replens, which is kind of like daily facial moisturizers. It's something you use vaginally on a daily basis to keep the moisture production up. And also for some people, if you don't have estrogen-based cancers, estrogen creams can be inserted into the vagina, and that also can help with vaginal lubrication. And then for men, some men do respond to the Viagra, Cialis, and Levitra after treatment. There's things called penile implants. So if in fact you have had some of the nerves cut or the blood flow compromised, penile implants are an option, and there are several different kinds. These are surgically implanted that enable a man to have intercourse. There is a device called a penile vacuum pump. It is something that is, and it's an external device, and it uses a pump and vacuum pressure to pull blood into the penis, and then a band is put around the base of the penis so that it's rigid enough so that intercourse can take place. And back in the day before the Viagra Cialis came on the scene, there was a medication called papaverine that was administered through injection or pellets. There's a little device that enable a man to insert pellets into the tip of the penis, and this medication can often help men to achieve an erection. And then this is somewhat controversial, but I've read it in a couple of places, so I'll pass it along. There is something called erectile rehabilitation. Is there a question? Sorry. All right. Yes? No? Oh, okay. Erectile rehabilitation. I would suggest you talk to your physician about this prior to your surgeries or other treatments. And that is if you've had surgery, radiation, chemo, whatever, and you're now at a place where you've healed enough, doctors are administering Viagra or Cialis, one of those medications, and a man would take that several times a week to produce erections, not necessarily to have sex play, but just to produce the erections so that the ability is maintained, and they've been achieving some good success with that. So some physicians are for it and believe in it, and some don't. You need to just talk with your physician about that. And let's see. Now, alternatives to sexual intercourse. How are we doing on time? I want to make sure and leave enough time for more questions, so I'm going to zip through the ending. So if intercourse gives you pain or you feel uncomfortable, consider finding other ways of seeking sexual pleasure and intimacy with your partner. By practicing sensual and sexual touch, you can experience sexual pleasure and closeness. It may be different from what you're used to or what you used to feel, but mutual caressing can relieve sexual frustration and make you feel like a lover again. Manual stimulation to orgasm, oral or anal sex, using a vibrator or other sexual toys are options for some, unless you have beliefs that lead you to feel uneasy about these behaviors. Only you can decide what's right for you and what sexual activities you want to engage in. And if you feel uncomfortable about any of these other alternatives, seek out help from your healthcare team or a counselor or your minister or chaplain, and see if you can possibly work through some of these beliefs that prevent you from trying alternative means of sexual satisfaction. Oftentimes people don't have sexual intercourse, they quit all forms of sharing affection. So it's important to continue with physical affection even if other sexual activities have stopped. Patience, time, and good communication can often work miracles for a lot of people. Now, I'd like to make one last point about dating. Some of you may be single and may be out there into the dating world, and the most frequent question that I get is, when do I tell somebody about my cancer and treatment? Well, if you've had physical changes as a result of your cancer treatment, it's kind of there and obvious. It's sort of a no-brainer. It kind of starts the conversation. But if you don't have any visible signs, my response to when to tell someone about your cancer is when they deserve to know, when they've earned the privilege to know, which means you're not coming from a place of weakness, like, oh, they're going to reject me, they're not going to want me, I'm afraid to tell them because they're going to, just abandon me. But if you think about the whole person and the whole relationship, and you feel trust, and you feel that this person is honest and is a worthwhile individual, then that's the right time. So trust your gut, but feel comfortable in the relationship. And I don't know if any of you have seen that there's a new movie out. I think it's called 50-50. Well, I only saw the trailer, and I just loved the little clip. It was the boy that had the cancer was saying, oh, will I ever have anybody to date? What's the rest of my life going to be like? And his friend was saying, wow, cancer, that's a chick magnet, you know, chicks love to care for people. You know, you're going to use it. And I just love that because they're coming from a place of strength rather than a place of weakness. And so I just thought that was real positive. Now, in your handout, I've also included conversation starters. I'm not going to cover that, but just know that it's part of your handout. So if you have difficulty bringing up the topic of sex and sexuality and intimacy and all of the rest of it, here's some suggestions about how you might open up those conversations. And, you know, physicians and nurses and whatnot are people too, and a lot of times they're uncomfortable talking about sexuality, so they may not bring it up. So you all may have to take the lead and bring it up to your physician. They may just, you know, tell you the medical things, but they may not ask you about, you know, how you're feeling or how is your treatment affecting your relationships or, you know, any of those kinds of things. And sometimes if you bring up and start the conversation, they'll be more than happy to either help directly if they can or send you to someone who can help you. So I would encourage you to talk to your healthcare team. Now, I'd like to share one last thing with you, one or two last things. I picked up this book. It's called Crazy Sexy Cancer Tips by Chris Carr. It's a compilation of stories from women who have had cancer, and they've written just different things that Chris Carr has collected and put in this book. And one that really resonated that I want to share with you was written by a woman whose name is Terry. And Terry says, "Sex is unbelievably life-affirming anytime, but especially when you're plagued with thoughts about your own mortality. Sex can banish fear and make you feel alive. Good sex during treatment makes you feel normal. Radiation and body scans can make you feel like a lab rat. But sex with a hot, loving partner made me feel like me. It was a reminder that life goes on, a respite from decisions and scary thoughts. It wasn't just sex that made me feel that way. Slow body massage, foot massage, a back tickle session, you know, the light touch kind, were all things that made me not only feel loved, but powerful, myself, normal. If your partner treats you like you're broken, it makes you feel broken. As women, we feel the need to take care of everything and everyone. But when I was being treated, I needed Vic, my husband, to hold my hand, quiet my fear, and at the same time treat me normally, which included having as much sex or more than usual, just because it felt good." And then just today, you know how on the internet people send those pink hearts to have, you know, like the forwards, you know, just to keep everybody aware of cancer and breast cancer, that kind of thing. Well, I got one today from a friend of mine who's a breast cancer survivor. And so I just jotted it down real fast and I wanted to share it with you. It says, "Life is too short to wake up with regrets. So love the people who treat you right. Forget about the ones who don't. Believe everything happens for a reason. If you get a second chance, grab it with both hands. If it changes your life, let it. Nobody said life would ever be easy. They just promised that it would be worth it." Thank you so much. So, that's my presentation. I hope I've covered some material that would be helpful to you and get you to thinking and seeking out help if you're having difficulties. And I'd like to open the floor to questions or comments. I welcome all of them. And then questions from our other, the viewing audience?
The viewing audience. And if you would just make sure you repeat, if we ask questions in here, if you'll repeat it, because they're
okay.
not mic'd up.
Okay.
If anyone has any, and
Maybe
I
you've
have a
written
question.
your questions down, so you've passed them back to Ethan. But if you have some questions from the...
I
Yeah.
do. It's not from our viewing audience, but as an emotional support counselor here in the Navigation Center, I get a lot of folks talk to me about their relationships as they're moving forward on their cancer journey. And I was wondering if you had some thoughts on. Oftentimes I hear people, I'm changed now. I'm somewhat of a different person now that I've been diagnosed with cancer, and I may not like my partner anymore, or I'm different, and sometimes this relationship, this partnered relationship that I'm in now is not the same, or I don't want to be with this person. And so that's a little counter to what you were talking to earlier about trying to keep a relationship together. And I was just wondering if you had any thoughts.
Well, I was talking about keeping relationships together if that's what you choose to do. Right. But it's not the kind of thing where you have to hang in there. We talked about meaningful endurance, not just endurance. You know, when we stay together out of fear, or because we were afraid we won't ever find anyone again, but the relationship is really toxic to us. It causes stress. That may be the kind of thing where you might want to give me a call and come in and do some talking, maybe with your partner. Come and talk to Ethan or other people, other resources who are available to help you process your feelings. So that you can look at your relationship and say, well, the physical, the cognitive, the emotional, the spiritual, what's lacking? Evaluate your relationship. So, it's not hang on for dear life, but, at this point, you've been given a second chance, and you want the rest of your life to be the best that it can possibly be. I mean, I know when I went through my cancer, I remember being in the hospital bed and wondering, I had a whole bunch of friends that came until they shoot them out, when visiting hours were over. And there I was, 23 years old in a hospital bed going, oh my gosh, it's me and my body. And no matter how much someone loves me, how, family support, I am the one going through this. And I really honestly feel that it changed my life in a positive way. I mean, I was pretty young for that kind of awareness, but to recognize the fact that I've got what it takes inside of me to manage this life. And so, finding a partner that really is a healthy individual and is as healthy as you are, because you're going to work at that. And that's the person you want to be with, not just because somebody's just been around and you're used to them, Another question?
It's an example, and it's actually something that I also hear a lot about through my experiences, and it's oftentimes the person who's diagnosed with the cancer is sometimes having to be the stronger one, and their caregivers or family members are falling apart around them, and oftentimes are needy, the quote unquote needy from the example here, and wondering if you have any thoughts on that about when you're the one diagnosed and actually your people around you are kind of the ones falling apart, and how you might confront that.
Well, that's unfortunate, but as I said before, when I read the lyrics to the song, I was talking about the fact that relationships are dynamic, they change, so sometimes the cancer patient is the strong one, sometimes the partner is the weak one, sometimes they're strong, and so if there is that kind of flow in a relationship, that's ideal. But if your partner is just isn't coping, I would encourage your partner to seek out help outside the relationship, so that you're not the one having to deal with all of the physical issues, the emotional issues, and take care of your family members. So you need to take care of yourself first and foremost. So seek out people who can be there for you, and then if you have a partner, support them to the extent that you can, but then encourage them to go out elsewhere to find the help that they need. Yes? The question is, do I have any suggestions for caregivers? And there are many books out there, and I will have to add that to my website because I don't have anything really good off the top of my head, but there are plenty of resources out there. So I will add that, and that'll be on my website. So.
If I can add to that, is just that we oftentimes, caregiver, there are some resources, not just books, but resources out there available for caregivers.
Sure.
One of which
Groups.
support groups. A lot of times, cancer treatment centers will be aware of those and provide those, and also, we hear, we help anyone affected by cancer here also, so that would be an option.
Great. Any other questions? Comments? I hope you all have learned something. I hope you've gotten something that you can take with you, and hopefully it will help. And I'm available. You can always email me. My information is on the handout, and there are these little cards that were passed out that have my information on. Ethan also has a stack of them. I really will try my best to answer any questions that come in. I want to be a resource for all of you out there. And so, again, thank you. More questions?
Not a question.
Oh.
We have some people in the audience saying thank you, and they
Oh,
appreciate
great.
Your words. So I just wanted to pass that along.
Well, thank you for tuning in. It was a real pleasure, and hopefully you all will use that relaxation response, the deep breathing. Believe me, I breathed a lot today in anticipation of public speaking can be a bit anxiety producing, so I was breathing all afternoon. So, when you're going through tough times, consider practicing it. And I do encourage people to practice it on a daily basis. And when I teach yoga, the yogis say, try and do the deep breathing for 3 minutes at a time, because it takes 3 minutes for the blood to course our entire bodies. So if you do that long, deep breathing, it will oxygenate every cell in your body. And the other thing that's kind of neat about the breathing is that it can be extremely helpful in helping you ward off colds and things like that. Germs and things don't live in oxygen-rich environments. So, getting that oxygen in your body helps you to defend against bacteria and diseases and that sort of thing, as well as produce relaxation and tension relief. So again, 3 minutes is a good time to shoot for. Let's see if there's any. Oh, and then of course you can do other tension reducing exercises. So if you find that a part of your body is tense, again like the shoulders, what we learn in yoga is to tense the muscles, which almost is a little counterintuitive. So if you're feeling tense, you tighten up the muscles, squeeze your shoulders up to your ears, and then when you relax, you achieve a greater sense of relaxation. So, practicing that long, deep breathing 3 minutes every day if possible, or when you're sitting at a traffic light, just take some deep breaths. Just brings everything down. And when your body is relaxed, you can kick in what we call the parasympathetic nervous system. So the sympathetic nervous system is our fight or flight reaction. It's when our adrenal glands produce adrenaline and cortisol and that sort of thing, and it prepares us. It tenses the muscles. Our eyes dilate. Our breath becomes shallow and rapid. The parasympathetic nervous system is the counterpoint. So when we relax, which we can do through our breath, it's like we fool the body into saying all the danger is over, it's past, everything is fine. It lowers the respiration rate, it lowers the blood pressure, it lowers the heart rate, the muscles let go, and we feel a lot more comfortable. So again, I really encourage you to practice the breath And there's lots of ways of coping with different stressors, stress, tension, anxiety, that sort of thing. So there are lots of resources out there. Well, are we out of time? How are we doing?
We've got a couple minutes. If anyone has questions here, of course, feel free to go ahead and ask questions. And if not, then we can be done.
Okay, all right. Well, thank you so much for coming and for tuning in. It was a real pleasure.